There. All right. So Dr. Shashi is on board. Perfect. All right. So Dr. Shashi is going to be talking to us about pre and postnatal care for moms today. So let me just give you a quick introduction of her. So Dr. Shashi Rawat, she runs a YouTube channel called Meta, which translates to Practicing Benevolence. It is a scientifically researched medical awareness and educational platform which promotes healthy conversations around medicine, and Dr. Shashi is also focusing on dispelling beliefs. So, Dr. Shashi, I think we can get started with your session. Just give me 1 minute. I'm going to unmute you. There you go.
Yes.
All right.
Hear me? Hi, Sanjana.
Hello. Dr. Shashi, I'm just going to ask you the first question here. So, why, according to you, as a medical practitioner as well as a mom, is prenatal and postnatal care as equal for moms as it is important to baby care?
Okay, so no, a couple of years ago during International Women's Day, there was this huge discussion on how a healthy world starts with healthy mothers, right? And because in our society, women form the backbone of every family. We've seen it in our own lives, right? Our mother places the needs of everyone else over and above her own. And I would go a step ahead and say that healthy women actually can be healthy mothers. So in my practice, I see a lot of patients who come with fertility issues. It could be due to PCOS, it could be due to endometriosis. And one thing that is common, I notice, is across socioeconomic strata in our country at least, the moment a girl gets married, there are constant questions on, when are you going to have a baby? Are you pregnant yet? And I feel no matter how educated a girl is, it plays onto her mental health somewhere, right? And if you are having fertility issues on top of that, the goal becomes having a child. So when I work with them through acupuncture to facilitate, whatever fertility treatments they are undergoing, I always try to bring the conversation back to how important it is for them to be a healthier version of themselves, whether it is physical health or mental health. Because, being pregnant, having a child is quite challenging. And when that happens, you have to be at your fittest best, right? Only then will you be able to take care of someone else. So I think it's time for us to move the conversation to us being the healthiest versions of ourselves before being mothers. And I think this change has happened because if you look at our country particularly, a couple of decades ago, there was this whole concept of pregnancy being a very physiological thing. कि हाँ हो जाएगा, अपने आप ही सबके बच्चे होते हैं. This was the kind of ideology that most people had. Unless there was some complications, medical help was not really sought after. But now, due to literacy and also due to community outreach programs, and there is more healthcare that is available to us, and social media has played an immense role in bringing forth a lot of taboo questions that weren't discussed before into the forefront. So now moms are coming out and talking about challenges that they are facing during pregnancy. How did they seek help? They're talking about how difficult it is with breastfeeding. They're talking about postpartum depression. So all these taboo topics that possibly during our generation we didn't even discuss with our mothers. Right? It's only when we get pregnant and we are having these conversations with other women in our family, we get to know of all the challenges they faced. But it never used to be like a common discussion topic, whether it was pregnancy or whether it was even menstruation. Now I think social media has given all of us that voice to connect with each other and to share our challenges with each other, which is excellent. So therefore there is more awareness that a woman needs to be taking care of herself during pregnancy, before pregnancy, and even after pregnancy. And that I think is very revolutionary.
All right, all right. That is so important, actually. I think every point that you mentioned. Okay, so we'll move to the next question, Dr. Shashi. All right, so what are your top 3 tips for prenatal care? And
Okay.
this can include foods to eat, exercises, being in a good mental space, all of that.
Yes. So I would break it down into 5 important things. Okay. The first is your doctor visit and in everything that a doctor advises you, whether it is blood test or treatments that he or she thinks you need. So doctor visits start, possibly a lady would come to know that she's pregnant around 4 to 6 weeks into her pregnancy, when she misses a last period cycle, and then she kind of takes a urine pregnancy test or a blood test. So from there on, from 4 weeks till 28 weeks, the visits are usually once a month. From 28 till 36 weeks, it's once in 2 weeks, and 36 weeks onwards, the gynecologist would ask her to come every week. So once you visit your doctor, of course, there's a detailed history that is taken, an ultrasound is done, then scans are done to ensure that the fetus is growing well, there is no complication, there is no malformation that is happening. There will also be weight gain charts that will be charted out to ensure that your nutrition is good. So doctor visits is one part of antenatal care. Vaccination, which is again very important, especially if you're pregnant during the flu season, your doctor might recommend a vaccination to you as well as possibly your partner or other people at home. The second thing I would say is, of course, nutrition. Now, nutrition is one aspect of what you eat and what your doctor recommends or asks you to refrain from. The best things that any doctor would advise is eating a well-balanced diet. Now, there is an old adage that when you're pregnant, you should eat for two people. That is completely not true, because a growing a growing fetus, can require anywhere from 300 to 400 calories, and for a woman of about 50 to 60 kilograms of weight, 1500 to 2000 calories is what we all require. So you don't need to eat for two, but what you do need to eat is possibly eat healthier and eat more balanced way. So you have to include your good fats, which comes from nuts, fish. If you are a vegetarian, then you can opt for paneer or tofus and things like that. Lots of green leafy vegetables, lots of fruits. So and your cravings, of course, get into it as well. You might crave something which is possibly not healthy, but moderation is the key. So things to avoid completely. So science has told us that any food substances that have high mercury levels, so fish, for example, mackerel, swordfish, any doctor would recommend you to avoid these. Also avoiding anything which is raw, which has not been cooked properly. You need to avoid all of that as well. Apart from this, if you don't have any specific complications, like if you're not diabetic, if you're not a hypertensive, just eating a well-balanced diet should do. Coming to supplements, it is extremely important that even before you get pregnant, when you are just planning your pregnancy, doctors might advise you to take folic acid as well as iron, because of course there is something called as hemodilution. Our blood thins out to accommodate and to grow the fetus. So that is something that you might start as a supplement even when you're planning your pregnancy. And multivitamins, of course. So nutrition and supplement is the second part. The third part, I would say, which is very important during pregnancy, is exercising. Again, there is a myth that exercising might harm the baby. That is untrue. Of course, doing anything which is extremely strenuous, for example, say going on a really fast run, or doing weights, things like these might harm the baby. But anything from say walks or doing yoga, especially prenatal yoga, is excellent, not just to get yourself moving and to feel good, but also for your mental health. The third thing I would say is swimming. Swimming, again, if you have been a swimmer, you've been swimming before, then there's no need for you to stop it during your pregnancy. So exercise and moving out kind of frees your body. It kind of gives you the endorphins that is required for a good mental health. That is number third. Number fourth, I would say, is information. Right? So the moment we get pregnant in this day and age where technology is giving us all the information that is required, let's be well informed. I think apps do an excellent job. There is an app called Baby Center. I used it for my pregnancy. It goes on a weekly basis. So most topics that questions you may have are answered in the app, and then it sends you a notification according to your gestational age. So I think making use of technology to be well informed and to be well prepared is something that we all can look into. And the final thing I would say is having a positive mental space. I know it's easier said than done, because with pregnancy comes all the mood swings, all the hormonal changes. Sometimes another myth I constantly find is that people think there will be a glow, you will feel look good, but unfortunately that's not the case for all women. No two pregnancies are alike. So it is extremely important for us to have this positive mental space, at least inside our head, which makes us feel calm and composed. Now, with the current challenging times, with the COVID-19 situation, it becomes all the more difficult to have that, because these are the times of anxiety and stress. So what can we do? One thing I would recommend is, don't read every piece of news that comes out. Allocate, say, one time a day where you are looking into the news, or if you don't even want to be updated, it's fine, but over information sometimes can cause stress. The second thing I would say is, find some activity which you love doing. One of the things that I enjoyed during my third trimester was packing my hospital bag, and I would do research behind, okay, what are all the things that are needed, so mother's bag and baby's bag and my husband's bag. So any activity that kind of takes your focus away from what is happening is helpful. Third thing, enroll into antenatal classes. Ask your gynecologist, or enroll into an antenatal yoga class where you get to meet other mothers and you can have conversations around things that are bothering you, because no one else would understand what you're going through better than other pregnant women. So joining an antenatal class would be extremely useful. Another thing that I would say, which I think I've heard from a lot of pregnant women as well, talking to your baby, right? So fetus can hear you. So you're talking to your baby, or playing a music that you think calms you down, or you want your baby to like, so you can kind of bond with your baby right from that instant. So I think shifting the focus from everything that is not going right in the world to things that you can control, things that you can do. Of course, uncertainty is something that can never go away. All of us are living with it, but making it in control of yourself is something that all of us, that most pregnant women can strive for. So these are the 5 things that I would recommend.
All right, doctor. And now this was the prenatal care bit. Now let's move to postnatal, so post delivery, right?
Yes.
A lot of women tend to they have postpartum depression that happens,
Right.
and it's becoming very common of late. But
Right.
at the same time, people unfortunately say things like, "Oh, maybe you're not ready to be a mother, or you're not fit to be a mother," which can be very hurtful. So, what are some 5 symptoms of postpartum depression that moms can look out for?
Okay, now there are 2 things here. One, postpartum is the 6 weeks after delivery. Medically, that is what we call the postpartum period. Now, it's been seen that 80% of women experience postpartum blues, so which are called baby blues, where a woman would feel extremely overwhelmed by what has happened, by the changes that her body has gone through. She might have spells of crying, she might have mood swings and sleepless nights. So all of this is a normal process. It's because your body is trying to get back to its normal self, and all the hormonal changes are starting to cycle back. So these are called postpartum blues, and this happens in 80% of the women. But out of those 80%, there could be 10 to 20% of women for whom these things might last longer, or they might be more severe, and then it becomes a clinical condition called as postpartum depression. Now, the most important thing, like you mentioned, they are easy to, labels are very easy, ki, okay, you're not ready to be a mother, but honestly, postpartum depression or baby blues, it's not a sign of weakness. It is a physiological process, at least the baby blues that happens. And postpartum depression is something that is clinical and that needs to be diagnosed and that needs to be treated. Now, coming to the symptoms and signs. So the thing to remember here is that the person who's feeling depressed might actually not even know it, right? So for example, with my case, I'll tell you, when my first son was born, and he had cord around the neck and he didn't breathe, and throughout that whole process I was quite strong, because I knew what was the outcome, what was to be done, and that he would come out of it. But when we got back home, I just couldn't sleep, because there was this constant worry that something was going to happen to him, and I didn't realize it. But when I went for my first checkup and my doctor took my blood pressure, it was quite high. And then the doctor is the one who kind of made me realize that I am suffering from something called as anxiety, and I'm suffering from that, because in my head I was like, everything is fine, it's all good, it's okay if I'm not sleeping. So a lot of the times it becomes the responsibility of people who are around, the partner especially, or the family members who are around, to identify these signs. Now, these signs could range from anywhere between feeling a sense of extreme overwhelming emotion, but also no motivation. There's not much motivation to get up and take care of the baby. There is a bit of a disassociation. There's this feeling that I'm a mother and I'm supposed to love my baby from day one, but for some reason I'm not finding the connect. And that kind of an emotion. or it could go sometimes to another extreme where there are feelings of harming myself or harming my baby. So these are some of the signs that a person who's suffering with postpartum depression might exhibit. So if anyone around them identifies these signs, then I think it's important to not wait thinking that okay, this will resolve on its own, but to help them seek the right medical advice. And the treatment might range anywhere from just psychotherapy or counseling, or if it is an extremely severe condition, then it could also include prescription medication. So taking timely help is what is extremely important here, and the woman might not herself be aware of it. And that's why educating the family members as well as the partner is extremely important. So in antenatal care, that was another thing, I wanted to mention, that it's a responsibility of the partner as well to be well aware of okay, pregnancy and what happens, and postpartum, how to help your wife go through breastfeeding practices, or how to help her have that rest. So all of these things are equally important.
All right, doctor. All right. And what are your best suggestions, again, as a medical practitioner as well as a mom? What are your suggestions to maintain postnatal wellness?
Okay, three things. Take plenty of rest. That's of crucial importance. Don't delegate. Right before you go to the hospital to deliver, I would recommend that any family member or any friend with whom your communication is good, to whom you can speak things out, ensure that they are a part of the team. When you get back from the hospital, so delegate your work. Your priority should be yourself, healing yourself and your baby. All the household chores can be taken care of by someone else, making food. And thankfully, we live in a society, at least in India, where help is available, right? We have either our parents living with us or our in-laws living with us, or we can count on some friends easily because of proximity. So make use of that so that you can take rest and heal. A lot of people say that sleep when the baby sleeps. Personally, I have found it extremely difficult, because when the baby sleeps, there are so many other things that I want to catch up on with my work and things like that. But just ensure that whenever you can, take rest, right? And second, I would say, is nutrition. Again, extremely important. See, after delivery, whether it is a normal delivery or a cesarean section, having regular bowel movements is very crucial for healing. And how will you achieve that? Only when your nutrition is well balanced and rich in fiber, dense food, right? So concentrate on nutrition, extremely important. Third, start with mild physical activity. So if you've had a normal delivery, once you are able to, you can move around, start with light walks. Okay, or when your baby is sleeping, maybe do slight abdominal exercises on the bed. So start mildly. Don't set yourself up a lot of goal, because all the weight that you have gained, it's there for a reason. It's there for is acting as an energy resource for your breastfeeding. So it will happen naturally. So don't push yourself, but at the same time, start with some kind of physical activity, and also expose yourself a bit to nature. In India especially, we have this practice where we isolate the women after delivery because of purifying some I don't know, evil spirits to keep them away, or there are a lot of myths behind it. And then the woman is kind of imprisoned within one room. If you can have a say in that, then I would highly recommend that at least go for a small walk inside your building, on your terrace, wherever you can, because nature can have that soothing effect on our mental health, right? So just a breath of fresh air. So start with that, and slowly, as your gynecologist advises you, you can build up on the exercises slowly. So take a lot of rest, eat well, start exercising. And finally, for positive mental space, communication is the key with your partner. There is something called as postpartum depression in fathers as well, which may happen, especially if they have a family history, or if the person himself was struggling through some mental health issues before becoming a parent. So communication is the most important thing. And to be honest, everyone's journey is extremely unique. Okay, so even though I might advise something, you might hear thousands of opinions from people. Your journey is going to be your own. And at the end of the day, it is very important that some days are going to be difficult, some days are going to be easy, and we have to accept that. Breastfeeding is a challenging practice. It takes time. Seeking as many professional helps as you can is what will give you plan of action that you can kind of stick to, and when you have doubts or when you face obstacles, you have a professional who has seen a lot of who has helped a lot of mothers through breastfeeding, can actually advise you the best, instead of listening to people at home, even though their intentions might be right. So I think we can avail all of these things in order to come back to our sense of normalcy throughout in the postpartum period.
Right. All right. So one point that you mentioned, doctor, I was not aware of this actually, that post-delivery women are kind of segregated to cleanse evil spirits and all. I was completely unaware about that.
Maybe they might not give that same reason, but I'm pretty sure, especially in North India, my grandmother told me that, you are supposed to kind of, and then when I had this chat with other friends of mine, I realized that, oh, this is quite a common practice where, a woman is, even in well-to-do families, it's not about
Right.
low socioeconomic strata. Even in well-to-do families, there is this notion that, a woman is not possibly clean enough. It's the same with menstruation, right?
Yes.
You can't puja ghar and things like that. So I think that all of that is unnecessary completely, of course, and we need to speak up for our own sanity. Is what, instead of waiting for others to understand, uh,
Right.
communicating what you need and what makes you feel better.
Right.
It takes some effort, especially
Right.
for us women, because we are not trained to voice out our feelings as much, and most of the times the feelings are not validated. So expression can be a struggle sometimes.
Right. Right. All right. Okay. So we are 2 minutes beyond our 20-minute time limit, but I think we started a bit late, so that's okay. And looks like we covered everything, Dr. Shashi, because nobody has any extra questions on the chat bar yet. So what we'll do is, in case anyone has any questions, they can email us at host@thepinkboxindia.com, and we forward it to Dr. Shashi. And you must check out her YouTube channel. We'll be shortly sending the link for her channel as well in the chat box. So yes, any closing notes, Dr. Shashi? We have been so happy to host you.
Thank you so much, Sanjana. What you're doing, I think, is excellent. Of course, with the Pink Box initiative, as well as now what you're doing for the. I think you should make this a yearly event where you bring in more, discuss more things, and as your followers grow, of course, right education, right information is the key to overcoming, most of the challenges that you're facing. So kudos to you and all the best to your team.
Thank you, Dr. Shashi. Have an amazing Sunday. We are so happy to have hosted you today.
Thank you, Sanjana.
Bye-bye.